to take a couple minutes to kind of describe for you what FEES is and how long it's been around and how it can help your patients in your facility. FEES is basically an acronym that stands for Fiber Optic Endoscopic Evaluation of Swallow Study. The term was originally coined in the mid-1980s by Susan Langmore, PhD, when she started doing research on this procedure. The procedure basically consists of passing a fiber optic scope, much like this one, transnasally on the floor of the nose to get a bird's eye view of the swallowing mechanism. It's past the gag reflex and nothing hurts. There's been multiple studies that actually compare FEES to the more established and more expensive procedure done at the hospital using X-ray mechanisms called Modified Barium Swallow Studies. Worst case scenario, FEES is equal to, but frequently FEES is shown to be better at various swallowing parameters, which can be discussed in another video. FEES is established, it's been around since the mid-1980s, and ASHA guidelines have said it's been well within the scope of practice of a speech-language pathologist since the early 1990s. So, who's Carolina Speech Pathology? Basically, Carolina Speech is a company that does bedside FEES to your facility, and we've been doing it in the Mid-Atlantic and in the Southeast since the mid-1990s, so over 15 years now. And it can benefit your patients in a number of different ways. First and foremost, it's much less expensive than sending your patients out to get a modified barium swallow study. Typically, an MBS can run you about $800 or higher just for what the hospital is billing you to get the procedure done. That's not including the cost of transporting the patient and the heartache of actually trying to find chaperoning for that patient if you can't find family members to go. Whereas a FEES saves time, energy, and effort, and is better patient care because we come to the patient. They're not disrupted, they stay at your facility, we use real food, and because there's absolutely no radiation associated with our study, we can last the entire duration of a meal, whether it's 10 minutes, 15 minutes, or 20 minutes if need be. Remember, this is a muscle and it can fatigue over time, and we can test for that using our FEES. So why would you want to contract with us at Carolina Speech Pathology to service your patients? First and foremost, I will tell you it's better patient care. The patient is not disrupted. They stay at your facility, no radiation and no barium, which is a constipating agent. Secondly, it's a considerable savings in money to your facility as well as to us as taxpayers. We're much less expensive. And thirdly, you get the report quickly and there's no loss of the patient. And because they're not away from your facility, you don't lose all that therapy time, whether it's PT, OT, or speech. To learn more about how we can help service your facility, call the number that you're going to see here in a second, or check out our website, and you'll see that in a second as well. Thanks for your time.